Dr. Ghobrial, what is MGUS?
So MGUS, or monoclonal gammopathy of undetermined significance, is a precursor or the stage before myeloma happens. And it's actually a very common disease or entity in many of us as we get older. In fact, maybe 5% of the population over the age of 50 would have this early MGUS. It doesn't mean that it's cancer, it's a precursor to cancer, and we can talk more about it as we go on.
All right. Is it the same as smoldering myeloma, or is that something different?
It's not. It's an earlier stage than smoldering myeloma, and it's hard to actually make the right definitions. But currently, what we say is if you have more than 10% cancer cells or plasma cells in your bone marrow, then it's smoldering myeloma. And by the name, smoldering it's almost myeloma. It's ready to go on fire, but it's not there yet. MGUS is before that. And the difference is that the chance of progression from MGUS to myeloma is only 1% per year. So many people will never progress to myeloma, while smoldering myeloma, just because there are more cancer cells in the bone marrow, has a higher chance of progressing, which is 10% per year. And in some people, very high chance of progression of 50% in 2 years. And we want to make sure that we catch those cases early and not wait for myeloma to happen.
Mm-hmm. How would you define myeloma?
So myeloma is currently defined as the same thing. The number of plasma cells in the bone marrow could be above 10% or more. You have a protein in the blood, but the problem is that you've already had problems. You've had symptoms and organ damage. So we have either high calcium, bone lesions or bone fractures, anemia, kidney failure. And then now, or more recently, we added a few more things to tell us these people are going to really develop myeloma soon. So it used to be part of smoldering myeloma. Now it's part of the definition of myeloma so that we can treat patients earlier, which is if your light chain level is very high, above 100 for a ratio, or if you have multiple lesions by something called an MRI or a PET-CT scan instead of the traditional X-rays, or if your bone marrow has a lot of the plasma cells, more than 60%. And these were new definitions to make sure we don't wait way too much until people have end organ damage or symptoms and then we treat them. And you'll hear from us that we think we should be treating people even earlier than that.